Welcome to Healthcare Musings, a podcast dedicated to the discussion of critical care, the medical field, and healthcare in general. Here is your host, Dr. Hesham Hasabala. All right. Hi, everybody. Happy to have you with me. Okay, so in JAMA, the Journal of the American Medical Association, they had a new series called the Data Brief. And this was published online on April 26th, last week. I'm recording this on May 1st. And it was the results of a poll by the Kaiser Family Foundation. Now they're called the KFF. And it's their Health Misinformation Tracking Pilot Poll. It was conducted last year, and it's public opinion research of a nationally representative sample of 2007 Black, Hispanic, and white adults about inaccurate information pertaining to COVID-19, gun violence, and reproductive health. Okay? And they also asked, and this is what I wanted to focus on, they also asked where people get their news and which sources of health information they trust. So the poll showed, and this is what I want to focus on, that trust in healthcare professionals crossed party lines. 95% of both Democrats and Republicans in the poll reported that they trusted their personal physicians to provide the right recommendations about health issues. And that's what I want to focus on. This is so important. The trust that people place in us to provide good information, accurate health information, the treatments we choose for them, the choice of antibiotic we choose, the choice of chemotherapy we choose, what kind of procedure we do, all of those things. There is so much trust on the part of the public, and we as physicians, especially physicians and clinicians, but most especially physicians, we cannot take that for granted. That is so important to me as a physician and a clinician, that a perfect stranger puts their utmost trust in me. When they come to the ICU, they may not have a choice, right? I'm on duty that day, and they don't have a choice to pick me. And yet, they trust me almost completely most of the time. They trust me implicitly to do the right thing for them or for their family member. I never take that trust for granted. That is something that is so sacred and special to me. And so it really behooves every single physician to take this to heart and to make sure that all the information that you are giving your patient is accurate. Make sure that the data that even me on this podcast, I got to make sure that the information that I pass along on my podcast is accurate. It's extremely important. Why? Because the public trusts physicians to have their patient's best interest in mind. That always doesn't apply. That is not always the case, unfortunately. And to me, that's criminal. You have to make sure that the information you provide your patient is accurate, and that the data is solid, and that you don't pass off things that are not supported by our literature. And we all know what that looks like. Now, if there's no literature, or if it's just based on expert opinion, okay, then you can look at the data and then form your own opinion based on your experience and expertise. But for a physician to pass on misinformation, which unfortunately happened during the COVID pandemic, that to me is inexcusable and unforgivable. People trust us implicitly, and we have to take that to heart. Just wanted to pass that commentary along. Thanks so much for your time and attention. And until next time, this is Dr. Hesham Hasabala for the Healthcare Musings podcast.